Hello, everyone. My name is Neil Benjamin Juarez, and today I'll be presenting my assignment for cross cultural communications. It's titled Cultural Values and Mental Health Approaches, a comparison between Japan and Canada. So, mental health affects everyone, but countries differ a lot in how they understand and how they address mental illness. Cultural values influence stigma, attitudes towards seeking help, and how mental health systems work. For this presentation, I compared Japan and Canada using Hofstede's cultural dimensions. These cultural values help us understand why each country's approaches towards mental health is so different. My main argument is that Japan and Canada differ in their mental health responses because cultural values they shape the public attitudes towards the public attitudes or stigma, and number two, because the formal access to care and treatment styles. So, Japan's cultural values. So, in Japan, cultural values play a powerful role in shaping mental health attitudes. Japan is highly collectivist, meaning that people prioritize group harmony and reputation. It also scores very high in masculinity, which discourages showing vulnerability, and it's also high in uncertainty avoidance, which makes mental illness seem socially uncomfortable or unpredictable. Japan's long term orientation also encourages people to prioritize social stability and saving face over addressing personal needs. All of these factors contribute to strong stigma around mental health. Historically, Japan has relied more on psychiatric hospitalization and biomedical care rather than community programs or counseling. Many people experiencing mental health struggles turn to family members instead of professionals. And because of collectivism, it emphasizes to not burden others. And many individuals delay seeking help because the stigma and fear of being judged makes it difficult for people in Japan to talk openly about mental illness. So, evidence and impact. There is strong evidence showing how these cultural patterns affect mental health. These surveys from Japan's Ministry of Health show that around 1 in 10 adults have experienced suicidal thoughts. In 2022, Japan recorded over 21,500 suicides, which was the second year in a row that the number has increased. Research shows that many people avoid treatment to preserve social harmony and to avoid judgment. So overall, Japan's cultural values, so the collectivism, the masculinity, and the high uncertainty avoidance and long-term orientation, they all combine to increase stigma and to reduce help seeking. Now, Canada is very different. We're going to move on to the cultural values. Canada presents almost the opposite culture profile. They score high in individualism, which encourages people to prioritize their own well being and to seek help when they need it. It also scores low on masculinity, meaning that Canadian culture emphasizes care, cooperation, and emotional openness. Canada also has a moderate uncertainty avoidance, which allows more openness to different treatment methods. The mental health system. Canada integrates mental health into its provincial healthcare systems. The services include crisis lines, counseling, suicide prevention programs, and community education. And Canada is very heavily invested into anti-stigma campaigns. Examples like Open Minds, campaigns like Faces of Mental Health, Elephant in the Room. And Elephant in the Room actually uses the blue elephant symbol to indicate safe spaces to talk about mental health. Now, evidence and impact. Research shows that these cultural values encourage help seeking. Surveys indicate that most Canadians they view therapy positively and see mental health as an important part of overall well-being. A 2023 Ontario study show that even youth initially felt stigma, school-based programs and counseling uh, made them more comfortable accessing support. Overall, individualism, individualism and caring cultural values help normalize therapy. It helps reduce stigma, and it also helps to promote earlier intervention. So there are a lot of differences between the two countries, Japan and Canada. And so we're going to discuss the similarities and the differences. So Japan's collectivism and long-term orientation encourages people to hide mental illness to protect harmony and reputation, whereas Canada's individualism and caring values, they support openness and make help seeking more acceptable. Japan relies more on family support and delayed treatment, whereas Canada promotes early intervention and accessible services. Both Canada and Japan recognize mental health as a public concern, which is something that is a similarity. And now, another similarity would be that both countries have government programs and policies, and they're both still struggling with some degree of stigma, especially amongst the youth. However, the cultural roots of stigma differ significantly. So this comparison between the two countries show that the cultural values directly shape how people understand mental healthness and whether they feel comfortable seeking health. Japan's social harmony and reputation-centered values can make people hide their struggles, and Canada's emphasis on self-care and emotional openness helps people reach out earlier. So to conclude, Japan and Canada demonstrate how cultural values influence mental health systems and outcomes. Understanding these cultural differences is essential for creating effective mental health programs. Intervention needed to fit the cultural values of each society, for example, family-centered approaches in Japan and youth-focused open dialogue programs in Canada. Thank you for listening.